So hello, welcome everyone. It's really good to see so many people joining us today on our first open session for Midweek Musings, our feline endocrine disease. So thank you very much for joining. I just want to let everyone know that the session is being recorded for internal training purposes. So I'll introduce myself first. So my name is Selina. I'm a program tutor for the feline practice distance learning program at Improve. And with me tonight, I have Alison Babington, who is our business development and digital learning coordinator. We have Christina Aguirre, who is a digital learning coordinator, and Samantha Taylor, who is an RCVS specialist in feline medicine. So this evening, we're going to start with an overview, which will be an overview of our feline practice distance learning program, including a quick demonstration of one of the interactive lessons. And then after that, we will turn our attention to the exciting topic of feline endocrinology. So Samantha will, she is the course director of the feline practice program, and she will share her knowledge on top tips for feline endocrine disease. So we'll be taking questions via the chat box. So at the end of the session, there'll be an opportunity for you to ask questions about the feline practice program and to ask Sam about the feline endocrinology. You can use the menu shown on the horizontal bar at the bottom of your screen to send your questions. And I will also add a link in the chat box for you to follow to enter your email to receive your CPD certificate after the session as well. So to start, Alison is going to give you a brief overview of the feline practice program.
Thank you, Selina, and good evening, everyone. Some of you will be familiar with Improve, but for those of you who are not, we thought it would be helpful to introduce ourselves. Improve's been providing CPD to veterinary professionals globally for over 20 years and was the originator of modular CPD. We are continually adapting and innovating our teaching and learning styles, from face-to-face lectures, practicals, to the more recent distance learning programs. We're a truly global company, offering CPD in countries as varied as Japan, the USA, Australia, and many European countries. In 2020, we delivered over 400 different CPD courses, providing over 1,000 days of training to the profession. Improve was created by a group of vets passionate about delivering high-quality, continuous education to the profession, and this is still the case today. By studying with us, you will take back to practice new skills, knowledge, enthusiasm, and confidence to handle those challenging clinical scenarios. So why distance learning with Improve? Our world-leading distance learning programs have evolved over many years and were developed to create a completely new online learning experience. Content has been developed and reviewed by veterinary specialists and is hosted on a world-leading, innovative platform. You are supported on the program by module tutors who are specialists in their field. The lessons are presented in an engaging and intuitive style with various learning activities to keep your interest and help you learn. These include the use of interactive quizzes, videos, labeling images, and click and drag exercises. The program is supported by a discussion forum where you can interact with your peers and module tutors. Being online, you can access your learning at any time you want, enabling you to fit your studies around busy practice commitments, so it's easier to achieve that all-important work-life balance. The feline practice course starts on the 1st of April this year and ends on the 30th of November 2022. There are 4 breaks in August and December 21 and in April and August 22. During these months, there are no new content releases, and these months can be used to catch up on the previous months and consolidate your learning. Samantha Taylor is our course director, and her role is to oversee the program, ensuring that the most relevant and up-to-date content is available. There are 16 interactive modules covering subjects ranging from clinical pathology to cardiology, from emergency and critical care to feline behaviour. You can find the content detailed module by module on our website. 17 veterinary specialists have contributed to the feline programme, bringing with them a vast range of experience and knowledge. Each module includes the following: pre and post module assessments, so you can evaluate your progress, 9 interactive lessons to engage with, and 2 case studies where you can apply your knowledge to real-life cases. They're supported by notes from the specialist author, recommended reading, introduction and summary videos, and of course that all-important discussion forum. Our programs are accredited by ISVPS and validated by Harper Adams University. They have also received RACE approval in the USA. And during the program, you can start working towards a recognised qualification. This might be the GP Cert Award from ISVPS, or with extended study, you can achieve a PGC from Harper Adams University. The PGC in feline practice is an eligible entry qualification for advanced practitioner status, which may be of interest to those of you in the UK. So I'm now going to hand over to Christina, who's going to show you on our learning management platform and demonstrate some of the features that we've talked about.
Thank you, Alison, and welcome everyone. I will talk about our world-leading distance learning platform. This platform provides a truly unique environment in which you can learn. The content is interactive and custom-made and delivers a new digital approach to learning. I'm going to show you briefly how it works. So just a second, because each module looks like this. And here you have, as Alison has already referred, the module introduction, the content for the 3 first weeks. We will come back to this shortly. The 2 case studies for the 4th week, the discussion boards where you can network with your peers and with the module tutor, recommended reading, and in the end of each module, you will have the course evaluation. This will only be available when you complete week 1 and basically is a questionnaire for you to give us feedback. So I'm going to show you a lesson. This is a week, okay, 3 lessons, notes, and a summary video in the end. Let's go for lesson 2, week 1. I'm going to start a new attempt just because I have already done this. When it's the first time, this doesn't happen. So when you start the lesson, you have always the learning objectives and a small introduction. In this vertical bar, in the left side, you have various sections, and in the end, you have the end of the lesson quiz that functions as a self-evaluation. So scrolling down in the lesson quickly, here you have an example of an activity. You should drag the words to the proper places. It's wrong. Okay, and well, if I do continue, I will then have the rest of the lesson. I can zoom in some images, another question, a multiple response question. I will do this randomly. This is just to show you how it works. It's wrong. I have the feedback. If I want, I can try again. I'll pass this quickly. And another example of activity is a sorting activity. I just have to drag the causes to, well, the type of hypoproteinemia. I have to complete them all to proceed. So here you have an example of an accordion. If you click here you will be able to read more information about liver failure, for example. So I just wanted to really show you a bit of this platform. There are a multitude of learning processes which we have implemented across every module to ensure you are confident to take your new learnings back to practice quickly. And hopefully this has shown you a couple of them. I know that you are all waiting to hear from Samantha, so I will stop there. Thank you very much.
Thank you, Christina. So now it's time for the feline endocrine disease section. Don't forget you can post your questions on the chat box and we'll get to those at the end. I will also just post into the chat box your link as well for the CPD certificate. So when it gets to the end, if you follow the link, you'll be taken to a website where you just enter in your email address, and then that's how you get your CPD certificate. So I'll now hand over to Samantha Taylor. Thank you.
Right, forgive me, I'm just starting off a bit of the tech here to make sure I'm on the right part. Okay, it should be working. Selena, tell me if you can't hear me or you can't see my talk, then do let me know.
Yep, everything seems to be working perfectly.
Oh, lovely. Okay, I always don't trust this. I don't know. We've been doing it a while now, all this. Thank you very much for the introduction. Also, the slightly more flattering photograph of myself that I seem to have sent in, where I don't have such dark roots. So anyone who's on lockdown at the moment will sympathise, I'm sure. We'll be back to normal soon, I hope. Okay, let's get started. As been mentioned, I'm the course director for the Improve Feline Practice course, and I'm really proud of it. I think it's, as you've seen, it looks really smart, it's really easy to use, but what's important to me is that you're getting experienced clinicians teaching you, you're getting practical information, you're not getting a bucket of references to read and work out yourself. It's a lot of practical and useful information depending on the way that you learn. Everything is catered for. So yeah, I hope you sort of have a look at it and take notice of it there, because it is looking really good at the moment. Okay, let's move on to why you're here. I wanted to write a short talk really about feline endocrinology, and the trouble is that there's quite a lot to say about feline endocrinology, so I probably end up writing a slightly longer talk than I intended to. But what I'm going to do for you is just give you a really kind of short tour of different feline endocrine diseases. We're going to cover diabetes, acromegaly, a bit of hypothyroidism, and then a bit of the slightly less common diseases. And what I'm going to do is, obviously I haven't got time to talk to you in detail about each one, but we're going to throw in a few top tips for each one. Just things that you can perhaps think about, read more about, and take back to practice. And then we'll throw in a few cases, because we all always like cases. Let's start with diabetes. Now, diabetes, you don't need me to tell you, is pretty common and certainly seems to be on the rise as well. I don't know if you're seeing more cases. I think we do see more cases now than we used 2 years ago, probably because of obesity and inactivity, so sort of lifestyle change. Most cats, the vast majority that you see, are going to have type 2 rather than type 1. And the important thing I want you to remember about type 2 diabetes is that it's not just a lack of insulin. Yes, a lack of insulin probably plays a role and certainly does later on, and we're replacing insulin by treating them. But it is a bit more complicated than that in cats. We also have this lack of sensitivity to insulin, so insulin resistance. And that means that it's more challenging to treat in some ways, because we've got to deal with factors that are working against us, essentially, whereas in dogs, in most cases, we're really just replacing what's missing. But what it does give it, to spin it a little bit better, it gives us an opportunity to induce remission. So in dogs, it's unlikely that you're going to reverse diabetes. In cats, you actually have an opportunity to reverse diabetes, which is pretty cool. So let's talk about that for a moment. There are a few studies about remission from diabetes in cats, and it's interesting because this review is a large review here done by the RVC group. They found it quite difficult to compare studies because they often have quite different sort of parameters of what definition of remission was, how they were assessed. And so it's a little bit difficult to compare and make conclusions. But what they really sort of talked about was that this strict glycemic control was important. So having the blood glucose kept in in a sort of quite tight manner was going to mean it's more likely to go, the cat is more likely to go into remission. They also found that newly diagnosed diabetics and cats on low carbohydrate diets. But it was a little underpowered and not entirely clear. But I suppose what we've always thought is that we need to control them quite tightly for them to achieve remission. So
Hi Sam, sorry to interrupt you.
Yeah.
There's just a sound. I think it's from where your microphone is
oh, I'm sorry.
with your hair. It's just making like
I'll hold it out a bit.
That's much better. Thank you so much.
Is it? Okay, no props. Thanks for telling me. So let's talk about this particular study, which is a really, really interesting study. So what they did in this particular study, which is, I think, an open access, so you can read this one. They, instead of doing tight control, did very, very relaxed control. So what they did was no home monitoring. All they did was basically re-see the cats, had the owners monitoring things like water intake, which actually is really important and gives you a really, really good idea of your glucose control. So they didn't do anything intensive. They based their dose changes on physical examination, so weight gain and weight loss, on how the owners said the cats were, and then on sort of single 12-hour post-injection, blood glucose levels. So this would probably make the majority of us feline medics quite nervous because it's really quite a loose control. It's making adjustments, no curves at all done. And what they found in this study, which I think is really, really interesting, is actually they had a really high remission rate. So the remission rate in this study was over 50%. They found some similar things to the previous studies in that using a low carbohydrate diet and cats that were generally requiring a lower dose of insulin were more likely to go into remission. So that makes sense. But I think it's really interesting that perhaps such tight control is not the key factor to remission. And perhaps it is more about how long they've been diabetic for, whether there are any reversible factors such as steroid use. So I think that is interesting and tells us a little bit more about how we manage these cases. So what are my kind of top tips from this bit? I think what I want to take home or back to the clinic is that overall, it seems that early detection is going to be an important factor for inducing remission. So can you find these diabetics before they are further down the track, basically? Can you manage them and change their diet before they are these more complicated diabetics? I think the introduction of diet is not always easy, and some of these cats will have comorbidities, they have chronic kidney disease, etc. But the body of evidence does suggest that if we feed them a low carbohydrate diet, we catch them early and we treat them appropriately, that they have a moderate chance of going into remission. Now, what these studies haven't examined is how long these cats stayed in remission for. And we know that cats that have been diabetic and entered remission do have a chance of coming out of remission. So it doesn't mean that we've completely cured them, but obviously any remission is better than no remission at all. So it is, I think, an interesting point to take home. So what I ask you to think about in your clinic is, can you identify these cats earlier? We know that cats are good at hiding illness, and I think we see a lot of diabetics later when they're severely PUPD and they've lost lots of weight. Is it possible that you can introduce some urine testing, some senior nurse clinics, and particularly aim your marketing, I guess, at cats that are at risk of developing diabetes? And so that's going to be obese cats and cats that are on corticosteroids. Paper came out recently showing this link between corticosteroids and diabetes. You know that probably from your own experience. Whenever we put particularly obese and middle-aged cats on steroids, most of them will be fine, but I think we've got to have our eyes open that some of them will develop diabetes, but that probably that's going to be reversible. So that's my sort of take-home tip from there. Let's jump on. I told you I was going to keep you awake tonight and jump around a few different subjects. Let's really wake you up by talking about a case. Now, this is a cat called Pumpkin, and Pumpkin is a 10-year-old male-neutered domestic shorthair. He's quite an outdoorsy sort of hunting cat. No particularly remarkable history, up to date with usual tests and vaccinations. He came in for weight loss and polyphagia, really, so was very, very hungry and was also noted to be PUPD. He was normally a cat that was outside a lot, but he was actually coming in and asking for food. On examination, he had just a mildly reduced body condition score, but otherwise nothing very exciting. And his bloods were consistent with diabetes. So I'm not going to show you all those bloods, you know what you're doing there. He started on treatment with protamine zinc insulin on a low dose that was slowly escalated, and he was changed onto a diabetic diet. So far so good, sounds okay. After a couple of weeks, he really seemed to go downhill. He'd improved initially, and then he just seemed to go downhill. So he was so polyphagic that he was stealing loaves of bread from the neighbours and dragging them home, which obviously was not very good for neighbour relationships. Now, Pumpkin was owned by a vet, is owned by a vet, and therefore they were doing, or not that just vets can do it, but he had no excuse not to, was checking some blood glucoses at home. And what they identified really was that the pre-injection blood glucose was hugely high, and actually it stayed pretty high all day. He was losing weight. Slowly, the insulin dose was escalated to what I think you'd agree is a pretty hefty dose of insulin for a cat of this size. So we did measure his insulin-like growth factor, which was very elevated. Now, although I'm telling you that I measured insulin-like growth factor in this case, what I do want to sort of, get over to you is that much as acromegaly and Cushing's and all these kind of cool causes of poor diabetic control, there are probably other causes that are more common. I had a dog recently that I just could not get control of, really poor control, and it turned out that the owners had put the insulin at the back of the fridge in contact with the back wall, and it had frozen and defrosted, hence why it wasn't working. And that was the kind of new one on me. It wasn't something I necessarily asked my clients. So there are other causes that are outside the box, really. So look at your own technique. Unfortunately, cats that have diabetes also like to have pancreatitis, and that interplay of those two conditions is confusing and challenging. And I think having a diagnosis of pancreatitis doesn't necessarily change how I treat the diabetes, but it makes me warn the client that they might be a little more up and down. And I certainly see some cats that will enter remission, have bouts of pancreatitis and come out of remission. So it's certainly having an impact on both their sensitivity and the release of insulin. Look for things like dental disease, urinary tract disease. But I do want to talk to you about acromegaly as well. So acromegaly is caused by a pituitary adenoma secreting excessive growth hormone. The vast majority of cats, although there are reports of non-diabetics, the vast majority of cats are going to be diabetic. Okay. We know that being acromegalic and having acromegaly can also have effects on other organs. So these cats can have essentially a hypertrophy of their ventricles, they can have a big liver, they can tend to have big kidneys. And what's often reported is this change of facial features. So you probably read about this kind of broadening of the face, prominence of the jaw, increase into dental spaces. We'll talk about how common that is in a moment. This is a little acromegalic cat that I saw when I was at Bristol. So is acromegaly rare? I don't know whether you're thinking now that you've seen a case or you haven't seen a case. The Royal Vet College a few years ago did a study, about 5 years ago now, where they offered screening for cats for acromegaly because they wanted to see how common it was. Other studies had shown a lower prevalence. So what they did is they recruited diabetic cats and they offered them free measurement of IGF as well as free advanced imaging. So quite a desirable study if you're a cat owner, certainly. And what they found was that about a quarter of the cats that were referred had a high serum IGF-1, consistent with acromegaly. And in fact, that IGF-1 above 1000 has quite a high positive predictive value for acromegaly. So if you have a high IGF-1, it's pretty likely that you do have acromegaly. What was interesting is out of that group, only about a quarter of the clinicians had any suspicion of acromegaly. So they may have referred them as poorly controlled diabetics, but most of the cats didn't have these consistent sort of classic textbook signs of change of face, etc. Now, it is possible that the prevalence in this study is higher because of selection bias, because the vets thought, some of the vets at least, thought that they might have acromegaly and therefore they sent them in for the study. So does it represent 1,200 normal diabetic cats, we don't really know. But it's interesting that they found a lot of cats had acromegaly, and they did MRI and CT, and you will see these pituitary masses. They had a few cats without pituitary masses that were still acromegalic, which is probably to do with sensitivity of CT for little tiny pituitary lesions in cats. So how do we treat it if we have an acromegalic cat? And here's Pumpkin here again. So hypophysectomy is now quite regularly done in clinics in the UK, and if you're coming from other parts of the world, I don't know how commonly it's performed there. The RVC have done a lot of this surgery now, and they're very experienced, and it's starting to be done in other centres as well. It isn't cheap, so the last one we sent I think was £5,000 or £6,000, that is, so you know, this isn't something for every client. And they do need ongoing medications. It's, you know, the clients must understand it's not magic, they're still going to need some tablets. But most of the cats that have had surgery will go into diabetic remission permanently. Radiotherapy is another option, and actually you do see quite a significant effect. Radiotherapy is quite effective. And a recent study showing this stereotactic treatment, so it's very targeted, frequent low-dose radiotherapy associated with very long survival times, but actually standard radiotherapy is also associated with quite long survival times, but not quite as good as surgery. If you can't send for these type of very expensive treatments or clients are not interested, then you can treat these cats medically. We often need to use very high doses of insulin, and the problem with that is that their growth hormone secretion can be quite pulsatile. So these cats still can have episodes of hypoglycemia. You know, we're using these very high doses, which they normally need, but they'll have a period where they have less growth hormone, and that's when they could go hypo. Because of this effect on the organs, they can develop congestive heart failure and chronic kidney disease. And there have been some studies on sort of longer acting somatostatin analogues, which showed some promise, but generally, and I recently did discuss this with the chap who was doing the studies, and he was quite dismissive that they would, you know, be practical clinically and effective. They were also usually very expensive. So what do we do with Pumpkin? We sent Pumpkin to the RVC, and he did really well. Discharged us a few days later. He was off Prozinc by the time he was discharged, and he has desmopressin drops, levothyroxine and hydrocortisone. And he's actually owned by one of our vets who is incredibly slack at picking up the medications and doing any form of monitoring. But this was Pumpkin recently, and this is about 4 years later, so he's doing pretty well. Classic vet owner. Okay, so my top tips for acromegaly are, as my summary and funny phrase, don't over test for it. There are other things that cause diabetic remission, but equally don't overlook it. It's probably more common than we think. Surgical treatment is probably the recommendation, but it's not going to be right for everyone, and we can still have a go at managing them as complex diabetics. Okay, so this is a bit of a trick one. Did you spot the Freestyle Libre device on the cat here? This is a cat called Henry, who's actually a female, was one of these missexed cats, so she is called Henry. And I just wanted to mention the Freestyle Libre device briefly. I could spend a whole talk discussing the Freestyle Libre with you. So what I thought, as I had a lot of pictures of it, I would just mention it. I'm sure that some of you are using the Freestyle Libre, and you can see that we've used it in quite a few cats. If you're not familiar with it, this is a continuous glucose monitoring device. We have a little sensor that we stick on the cat. This looks more sharp than it is. It's actually a little bendy catheter, and it measures interstitial glucose. You can use an iPhone, or you can use a little reader device. Now, these are human products. Humans wear them on their sort of upper arm. And in cats, we tend to put them in different locations, but usually on the lateral thorax or slightly higher on the shoulder. We've had a mixed experience with them, I would say. In some cats, they're hugely useful. This cat called Archie is quite difficult to take blood samples from, and that was very useful. In Hen had multiple episodes of DKA, had concurrent pancreatitis and chronic cholangitis, and you can see from the feeding tube here. And so that was useful to give us signs of impending poor control. What's important about the Freestyle Libre is it doesn't give you exactly matching interstitial glucose and blood glucose results, and so people will often say to me, but they're so different from each other. It does take a little while for equilibrium between the blood glucose and the interstitial glucose, so it's always sort of playing catch up. And that's what this little arrow is on the reader device. It's telling you if the blood glucose is going down, if the interstitial glucose is going down or up. I think it is useful for trend monitoring rather than specifics. I think it's quite useful for detecting remission in diabetic cats, because we suddenly see on the graphs much better control and that they're spending the majority of their time with a lower blood glucose. We can also see some Morgies. So it has specific uses, but it's not perfect, would be my kind of take home message from that. And I'm happy to take any questions about the Freestyle Libre. But we better move on before I get told off for going kind of way over my time. Let's jump on and let's talk about hyperthyroidism, but I'm actually going to talk about hypothyroidism. So what I'm talking about is iatrogenic hypothyroidism. Now, this occurs post-treatment for hyperthyroidism, and I thought, well, there's no point talking to you about hyperthyroidism. I'm sure you're very happy and familiar with the management of that disease. But this is really a kind of emerging area, and I'll talk about how our sort of thoughts on hypothyroidism have changed over the years. So it is quite common, and it happens after medical treatment, thyroidectomy, radioactive iodine. It's probably best studied after radioactive iodine. And we know that after radioactive iodine, almost half of cats will have iatrogenic hypothyroidism. As mentioned, if you overdo it on the medical treatment, you will cause it as well. And certainly we see some bilateral thyroidectomy cats that develop it. They may have no clinical signs whatsoever. And in general, the greatest effect when you're looking at radioactive iodine cats is in the first month after they've had some treatment. Now, why are we worried about it? Why am I even talking about it? And certainly when I was doing my residency at Bristol, we did a lot of radioactive iodine, and we didn't really, be blunt, we didn't really worry about it. It generally would recover in time, and we didn't feel that it was a negative for the cats. What we know now, and from a lot of work that was done by the RBC group, was that being hypothyroid, makes sense, reduces the glomerular filtration rate. Just in the same way as being hyperthyroid increases the glomerular filtration rate. So these cats with a reduced GFR may become azotemic. So it makes sense. We can have two types of iatrogenic hypothyroidism. We can have a subclinical hypothyroidism where essentially the body is trying really, really hard. So you've got a very high TSH, which is trying to find any remaining thyroid tissue and just managing to keep the T4 normal. And then we can have overt hypothyroidism where we've got a low T4 and a high TSH. So it makes sense, just the same as a dog that you're assessing for hypothyroidism. So those are just two things. We'll talk about them in more detail. What we know from some of this work from the RVC is that being an iatrogenic hypothyroid actually may reduce your survival. And obviously that is important because we want to maximize the survival of these cats. So cats that are hypothyroid are more likely to be azotemic. And if you're azotemic and hypothyroid, then you won't live as long, is the bottom line. So this is a Kaplan-Meier survival curve taken from the study that I've mentioned here. And what we can see is these solid lines are non-azotemic iatrogenic hypothyroid cats. This is a study of cats that have been treated with radioactive iodine. And what we can see is that the group that are azotemic by this sort of barred line, these cats, every time it drops is sort of a cat dying essentially. And so what happened is you start at the top with all the cats in the study alive, and then you slowly drop down as you're losing cats really. And what they found was a significant difference. So if you are hypothyroid and azotemic, then you don't live as long, is the bottom line. And so this was obviously a really important development when we were looking at how we treated using radioactive iodine, but also using other therapies. So what we probably should do is look for it a little bit more. And we didn't used to necessarily. We would look for azotemia, but we didn't necessarily look for them just being iatrogenic hypothyroids. So how do we make the diagnosis? Well, we do need to look for these overt and subclinical hypothyroids by including measurement of TSH. Now, T4, I'm sure every lab measures T4, fine. The reference ranges might vary a little bit between different labs. TSH, it's using a canine assay. So if you phone up the lab and say, I want to measure a feline TSH, they'll say we can't do that. So the labs are in most parts of the world using the canine assay. And what that is just telling us is really that we have a high TSH. So something is trying to push the thyroid to produce, the remaining thyroid tissue to produce T4. Now, in the USA, I'm not aware of it happening in the UK, but please correct me if you know that that is the situation. In some places, they're so worried about this that they are actually treating cats with levothyroxine after radioactive iodine because they know they're going to have this period where their glomerular filtration rate might go lower. This is my own cat here, post-thyroidectomy. And obviously being a vet's cat, she got very minimal monitoring post-operatively, which having found all this out, I felt guilty about, but she did very well. So if we do diagnose this, we do want to treat it medically, but we need to keep the T4 kind of at the low end of the reference range and not below. What's confusing is if this group of cats develops a concurrent disease, then we can get a euthyroid 6 syndrome and the T4 can drop a little bit below the reference interval. So these cats need a little more monitoring perhaps than we thought. If you're using medical treatment of the of hyperthyroidism, you just need to be cautious and not over suppress these cats. And the product that we're going to use to treat them generally is a dog product off license, but Laventa, certainly in the UK and I think in Europe, is used because it's a liquid. If you use tablets, you're going to have to use tiny, usually kind of fragments. I have some cats that are not very good on liquids, or one particularly challenging cat, and that cat we do use some fragments of tablets. So there's some dosage information for you here if you do have to treat a case after you've done thyroidectomy or referred for radioactive iodine. Ideally, we give it on an empty stomach and we give it twice daily. And what we'll tend to do is treat them like hypothyroid dogs. So treat them for about 6 weeks, and then we check their T4 and their TSH post-pill, just as we would with a dog. And we're aiming for the T4 to be kind of mid to top reference interval. Do they recover is a question. Some of them seem to, some of them don't, and that may be related to what dose of radioactive iodine they're given as well, if we're talking about the radioactive iodine group. In general, we'll say, well, treat them for a little while, and then we'll stop the treatment, leave them a couple of weeks, and we'll reassess how they're doing at that point. And that includes assessing their urea and creatinine. So we can just see that's our best estimate of GFR. We don't know so much about how SDMA is going to behave in this situation before anyone sort of asks me about that. It's a reasonable suggestion. SDMA is a little bit funny the way it sort of seems to perform in hyperthyroid cats or hypothyroid cats. Let's tell you about a case just to make sure that you're still all awake. This is a cat called Ellie, and she was what I call a straightforward hyperthyroid cat in that she was diagnosed and no particular complications. She was treated with methimazole. She didn't become azotemic, and she was referred for radioactive iodine. And then we did the follow-up, and now she didn't have a 1-month follow-up. I'm not sure why. She's a little bit of a challenging cat, and I think the owner felt she was a little bit traumatized by her stay for radioactive iodine. The cat didn't, but the owner perhaps did. So it got to 3 months post-treatment. And I just want to show you some bloods. So I'm going to let you look at these for a moment. Obviously, the main concern, the main thing we're looking for is the urea and creatinine. Now, we always look for stable urea and creatinine before we draw any conclusions, but actually we did repeat this later and it was a similar level. The keen-eyed at this time of night amongst you will notice the glucose as well. But let me give you some more results here. So we also measured her T4. Now, again, different reference ranges in different labs. In this lab, 7.5 to 55. And I think you'll agree that the T4 is getting a bit low. And then if you remember, we showed some reference intervals that this is a pretty high TSH. So she's got subclinical hypothyroidism, but almost overt hypothyroidism post-radioactive iodine treatment. Now, in the past, we would have ignored this and left it. The cat's doing clinically quite well. But what we know now from that work is that we actually, by leaving it, may be affecting her survival. So what would be probably better is to treat her. So we did start her on some levothyroxine, and she, subjectively, from the owner's point of view, seemed a little more lively, and we haven't since done our recheck. This is a recent case. You're probably wondering about this glucose and if I'm going to tell you something about her being diabetic. Now, I think she's quite a good example of a non-diabetic cat. I have no reason to believe that she's diabetic, but she is a very anxious and stressed cat. And sometimes with lots of stress, they can push their glucose right up. Now, we give her gabapentin, interestingly, before she comes in, but she still is a little upset. And so we've got a high glucose here. We since checked urine at home, and we checked blood glucose at home on an ear prick. And she's had a normal blood glucose. So just included because I thought that's interesting. We often think that stress will only increase the blood glucose a certain amount. What we don't know is if she's perhaps pre-diabetic in some way and would develop diabetes later. I hope not. I can't cope with that after we've done all of this. Okay, so I just thought she was an interesting example. So my top tips for hypothyroidism really are to not miss these iatrogenic hypothyroid cats, because even the subclinical cases might have a low GFR. There was a study from Bristol not long ago where they actually measured GFR, and they found that these subclinical cats had a reduced GFR without being azotemic. So that was interesting because, again, probably underestimating the impact of that in subclinical cases, a normal T4, but a high TSH. And it may occur, actually, in that study also, they showed that even between 6 and 12 months, some cats were developing iatrogenic hypothyroidism. So even if you're not referring for radioactive iodine very frequently, I hope you are, I'm managing to do so, but even if you're not, in your medically and surgically managed patients, then we've got to think about where that T4 is. And we've got to monitor them for developing azotemia as well. Note I haven't mentioned diet because in my experience, dietary management of hypothyroid cats, they're not well enough controlled to go hypo, but correct me if I'm wrong. Okay, so I told you I was going to jump around, so let's jump around a little bit, just check the time. So let's talk about hyperadrenocorticism. Let's talk about Cushing's in cats. Now, this might be something that you don't see, terribly frequently, but it is something you don't want to miss. We'll talk a little bit about its differences from the canine disease. So, hyperadrenocorticism, what are our clinical signs? Not rocket science, they're similar to the dogs that you're probably more familiar with seeing. PUPD, abdominal enlargement. Here's a cat here. This cat's got, I think you can see this kind of really thin skin and big fat belly, big round belly. Not all of them, but some of them will be polyphagic. But what's interesting is a lot of them have skin changes and skin atrophy. We'll talk about this in a moment. Muscle wastage, almost half of them weight loss, and your standard cat presentation of lethargy. Alopecia and skin fragility I want to talk about in a little bit more detail, because this is, and certainly in my experience, maybe even more common than that. Why are they not like dogs? So in a few ways. They don't seem to develop PUPD until later on in their disease process, and that PUPD is usually associated with them developing diabetes. So as opposed to dogs with hyperadrenocorticism who tend to be PUPD and present as PUPD, this might be the prompt that brings the client in, but it might be because they've then developed diabetes. Cats with Cushing's disease tend to have very fragile skin, and we'll show you a case in a moment. I can't stress enough, it's just quite different from the dogs. Yes, the dogs seem to have some thin skin and they have comedones and their skin doesn't look, look say trophic, etc. But these cats can have really thin skin that tears very easily. And as you can see from this data, weight loss is more common. They may develop abdominal enlargement, but they've usually had quite a lot of muscle wastage and weight loss. And then quite a lot of them will be diabetic. So this is quite a difference from the dogs. I see in referral a few dogs with diabetes and Cushing's, but I don't think it's hugely common, whereas we're looking at a high percentage. And in fact, all of the cats with Cushing's that I've ever seen have always been diabetic. So it's something to think about in your diabetic patients, but we'll talk about how common that might be in a moment. Other clinical signs: big liver, poor hair coat. Here's a cat here with a kind of really scurfy hair. This is not a clip for ultrasound, it's just a sort of hair loss on the sides. Weight gain is reported, so some cats will gain rather than lose weight. And some cats will develop a plantar stance, but again, that probably relates to the diabetes. However, we know that that kind of neuropathy can present in Cushingoid dogs, so it may be related to the Cushing's. Probably got 2 reasons to develop that. Here's a case study, and I thank my colleagues at Bristol for allowing me to share the photos here. This is a cat called Darcy, and Darcy had a sort of 4-week history of weight loss, alopecia and non-healing skin wounds. This cat had been clipped and hair had not regrown, and the development of PUPD only quite recently. On examination, sort of dull and depressed, some weight loss, particularly muscle loss and abdominal enlargement, and the skin lesions that you can see in these photos. So sort of non-healing scabby wounds where they'd been clipped has not regrown. Okay, so really fragile skin and non-healing wounds. And a lot of these wounds caused by simply handling the cat, simply picking the cat up. How do we make a diagnosis of Cushing in cats? Now that is challenging. Imaging and abdominal ultrasound is often very, very useful. And in Darcy, we saw this enlarged adrenal gland. And again, you know, finding adrenal glands in cats is not always for the faint-hearted, and you need a decent ultrasound machine in order to do that. And so that's not going to be straightforward for most people in general practice. But if you can refer or you have a visiting imager, this can be really useful. CT, MRI, obviously going to give you lots of information about the adrenals, but can be a little bit more expensive and may not change what you do. So how do we treat cats with Cushing's? Well, we manage the diabetes, which in itself can be difficult with a comorbidity, but I'll talk about that in a moment. Feeding a low-carb diet makes sense, starting insulin therapy makes sense, but being very aware that as we try to treat the Cushing's disease, we might have unpredictable response to insulin. And then we can use trilostane, and trilostane or Vetrol is reported for the treatment of hyperadrenocorticism in cats. There are quite a few reports of its use. There is a liquid available in the UK and I think in other countries, so that allows better, more accurate dosing. Most cats will show some response, but they may not resolve their diabetes. Now, monitoring is pretty similar to the dogs, although in dogs we tend to use the pre-Vetrol cortisol measurements now. In cats we don't have that data really, so tend to use ACTH stimulation tests. And adverse effects of trilostane are definitely possible, so GI signs really, or we can overdo it and make them hypoadrenocorticoid. So what are my top tips when we're talking about hyperadrenocorticism in cats? There are a few things that I just kind of want you to take home. Interestingly, cats with Cushing's tend not to be as insulin resistant as acromegalic cats, and they tend to be much more unwell. So people say to me, well, should I test for Cushing? Should I test for acromegaly? Look at that case and look at the clinical signs. Cats with HAC tend to lose weight rather than gain it, whereas in acromegaly, usually their body condition is preserved. But they do tend to have marked hair loss or cutaneous lesions. So I had an advice, just recently with someone saying, poorly controlled diabetic, shall I do an ACTH stim? Shall I do this and chase down Cushing's as a diagnosis? And I would just say, pause for a moment. Don't chase the testing unless you've got a really clear clinical suspicion, because the testing is not perfect. So ACTH stims are pretty useless. In general, we will do urine cortisol creatinine ratios. Low dose DEX tests are better. And you can there's a protocol for doing a combined version. You have to have a client who can collect urine in their cats. So it's a challenging, it's not as if there's an easy diagnosis. So if you're going down that path of chasing it, you need to have clinical confidence. A bit the same as dogs really, because there's so much crossover and the tests are just not completely clear. So those are my sort of top tips for that. Here's this little cat, had diabetes and Cushing's. But here's a few pictures, again, thanks to my colleagues at Bristol. This cat did do quite well on trilostane, and I think you can see, you know, finally wound healing and some hair regrowth. But I would say my experience, which is not a lot of cats because this is not a common condition, is that the response to trilostane is a little hit and miss, and they're still quite challenging diabetics, so they still need quite committed clients. Okay. Let's sort of finish up, and I'm approaching the end of my talk here by talking about my kind of final endocrine disease, and that's Conn's syndrome. So Conn's is actually more common than Cushing's disease, so it makes it the most common adrenocortical disorder in cats. And if you're not familiar with it, essentially we've got an autonomous secretion of aldosterone, usually due to a tumour of the adrenal glands, although there are some cases reported with just hyperplasia of the adrenal glands. It isn't common, but it's another one that's possibly underdiagnosed. I don't think Cushing's is underdiagnosed, you see what I mean? Whereas I do think some acromegaly and perhaps this Conn syndrome would be another one that's slightly underdiagnosed. It's potentially quite an important cause of hypertension. And here's a cat that we saw at the clinic, and she's called Daisy, who developed acute blindness due to hypertension. You can see her high femur in this eye, and then sort of bilaterally dilated non-responsive pupils. You can see that a combination of hypokalemia, hypertension, and azotemia is very easy to put down as chronic kidney disease. Quite absolutely fair to say that. But does that mean that a few of those cats could actually have Conn's syndrome? So my top tips for hyperadrenocorticism, and I want to get on my high horse, I guess, and talk about, because one of my favourite topics is about blood pressure measurement. And just to ask you if you are measuring blood pressure in cats in your clinic, and in which case, which cats? There's a good argument for measuring it in all cats above around 8 years of age, so that we've got some baselines and it's just part of your physical examination. I much prefer the Doppler method in conscious cats. There's some work recently showing, you know, that the oscillometric is giving a reasonable reflection, but I just think that the oscillometric, if it's not connected to a computer so we can watch the trace, I've certainly seen some cats referred as normotensive that are super hypertensive, and it's the oscillometric that's misled a little bit. So it's just something to be aware of. And I do think that a quick Doppler measurement is easy once you get used to it. So I just, ask you to think about your clinic. Measure it, wherever and whenever. Measurement of blood pressure doesn't have to be something kind of traumatic for you or the client or the cat. In fact, it shouldn't be. And we've got a cat here. I've got a little video. Just move my things over. You can't hear the audio in this, but I just want you to get an impression that we're measuring blood pressure in this cat. It's sat in its cat box, in the base of its cat box. So that's where you should be examining lots of your cats, taking the top off so that they're still in the bottom of the cat box. And this cat's not got anyone holding its feet. And my colleague, friend of mine, Carla, is measuring blood pressure. So what she's done is she's just positioned, she's put the cuff on, let the cat relax, and she's just sneaked the probe under the leg there with some gel on. You can see where we spilt a bit of gel with the gel on there. So she's not even restraining this cat. So we know that stress has an impact on our measurement of blood pressure. But I think you could agree, this cat doesn't look 100% happy, I'll agree, but he's probably a lot happier than if he was being sort of heavily restrained or having his feet touched. And I always direct you, probably because I'm biased, because I was one of the editors, but there's a nice document here that discusses which groups of cats we should be measuring their blood pressure. Oops. Okay, so I think I've reached the end of my whistle-stop tour through endocrine disease of cats, and I'm very happy to take any questions. And if there are questions that we don't have time to ask, then I have popped my email address on there. And these are some of my cats. This is my old cat that I lost a little while ago. This is my very special cat who I adopted from Cats Protection, sucker for a cat who came into work. I never worked out what was wrong with her, but she seems okay. And then I even have a broken brachycephalic dog, but don't tell anyone because that's kind of embarrassing. Thank you very much.
Thank you, Sam. I'm sure everyone will agree there's some really useful tips to take away there. So we'll now open up for any questions for the next 5 minutes. I have got some questions already that have already come in. And then if you have any questions that aren't answered, you've got the Improve Enquiries email there. So if you want to send those to your email questions to there, if they're not answered, that'd be great. For your CPD certificate download, I'll just copy and paste the link into the chat again for you. So if you follow that link, you'll just enter in your email address and you can download your certificate through there. So I'll move on to some of the questions for you, Sam. So one of the questions is, how big a risk factor do you find development of DM for cats being treated with longer term steroids?
It's a good question. There's a nice paper in FRCVS recently looking at this, but they only really looked at if cats did develop diabetes on steroids and concluded that yes, they do. It's an interesting one. I had a case not long ago that was a cat that was quite complex, had pancreatitis, but also had an eosinophilic granuloma in its mouth and was treated with actually oral dexamethasone because he didn't respond to pred, so like the worst thing that you could do for diabetes, and came in as a DKA case. And I thought, well, that's the steroids, that's got to be the steroids. Long and short of it, we had to eventually restart the steroids and the cat remained in remission. But whenever it got a flare of pancreatitis, it would become diabetic again. So I think it's really case by case. I think it's a risk and we perhaps should not ignore that. But I think cats are relatively tolerant of steroids, and it depends on the case and whether they have other risk factors. So what the diet are they on, what body condition are they, do they have concurrent inflammatory diseases that are going to cause insulin resistance that's going to kind of push them over. Now most of them do, and that's why you're using steroids. It doesn't stop me. I'm a medic. I use a lot of steroids. I've probably over the years got a little more twitchy about using high dose long-term steroids in that risk factor group of cats. It doesn't stop me doing it, but what I do is I just monitor them a little bit closer. And for clients, all they need to do is just have a urine dipstick and even just press the glucose pad onto a wet bit of litter to just reassure us there's no glucose. You don't necessarily need to have them in and do multiple expensive blood tests. So in some of my cats, I get the owners to do that. Obviously, if they use litter trays, then that's easier. So it is a risk, and I think we need to be aware of it. But I don't think you're going to see it every day. And I think if you see a lot of cats and a lot of medicine, you've probably got a lot of cats on steroids, and they're very tolerant of it. But we all remember the ones that we have made diabetic, certainly.
Thank you. So another question is, which low carbohydrate diet / food do you recommend for diabetics?
I don't think it matters a huge amount. If you look at the diabetic diets made by the good, decent companies, they all have high level of protein, low level of carbohydrate. If you have clients that are not flush with cash, then actually if you take a cat that's on a low quality dry food and put them on even a bog standard wet food, the wet food is going to have a higher protein and lower carbohydrate level. So if there are clients who are invested in their cats that have got a good appetite, etc., then I will use one of the usual companies. We use a lot of Royal Canin diets, but the Hills diets are perfectly reasonable. So we'll choose one of those. But if you have got cost restrictions, then you can just use a wet diet, and there's a lot of arguments for using wet diets. In fact, some cats on a wet diet will then lose weight if they're obese because they're less calorie dense and they've got higher protein, lower carb. So it's a bit of a win-win all around. So but you have to look at the whole cat. Some of these cats have comorbidities that will alter your choice, particularly if they have chronic kidney disease. But generally you're just looking for a high protein, low carb.
Thank you. So another question is, those being medically treated for hypothyroidism, would you advise keeping the T4 levels to middle / upper end of normal T4 range to help combat azotemia?
Yeah, I think so. I think we've got to keep an eye on it, and we certainly don't want it to be low end or below that, particularly if they are azotemic. So if you have a cat that you're monitoring and they're headed towards that downward trend, in the past, I wouldn't have necessarily worried about that so much, because I do still think, you know, that hypothyroid control is the critical factor. And even when you have a cat with chronic kidney disease, you must control their thyroid. But now I think, yes, you're right. We accept that probably we should keep it in the middle, to slightly above the middle, essentially, and keep it there. And that's sometimes a little bit awkward with tablets. If you're using tablet medications, you sometimes might have to, even I've had the odd cat that's had to have kind of every other day dosing, hence the growth of the liquid treatments, to be honest. And if you look at the Thyronorms, and I can't remember the name of the one that's been recently licensed, the beauty of them is that you can do subtle changes in dose so that you can maintain the T4 a little bit better, whereas before it was, you know, one tablet and you couldn't split the Videlta. So that's helped a little bit. But you're right, yeah, I agree with you.
Okay, and then I think we can do one more. So let's have a look. There's quite a few questions in here, so I'm really sorry, everyone. I don't think we'll get through all of them.
Do email me though. That's absolutely fine. If you want to email me, it's no problem.
So we'll finish with this one. She says, hello, thank you for the presentation. I wonder if you had any good hints or tips if you ever need to change a diabetic cat from Prozinc to caninsulin. We had issues getting hold of Prozinc and didn't know any good protocol to follow.
This has been a problem this year, well, last year it was. It seems to be solved now. I don't know if you agree. I've got quite a few Prozinc cats, and we seem to be able to get it again. It's not a direction that I like to go in. If you look at all the guidance, and so I'd direct you to, there's a couple of really good documents that are guidelines, as ISFM guidelines, for example, on diabetes. The general recommendation is for intermediate to long-acting insulin, so that does not include caninsulin. And the problem with caninsulin, as you probably found, is very short-acting. But I agree, in that situation with the UK licensing, you had to move from Prozinc to caninsulin. And I think what you've got to be aware of is that different duration of action. And probably if you use the same dose of caninsulin as you did of Prozinc, you may see quite a dramatic and rapid drop in the blood glucose. So what I would do in that situation, unfortunately, is step back a little bit and probably go to 0.5 unit per kilo twice a day, and almost start again with monitoring and slowly increasing it, because I do think that their response to those two insulins can be quite different, both ways round, because obviously of the different length, sort of different duration of action. So I probably haven't got enough tips for you in that way, apart from not to be cautious with your dose, because I think you do find these odd cats that will do a very rapid drop on caninsulin and then they go straight back up again, and if you don't catch that drop, you'll think that they're poorly controlled and increase the dose. So yeah, I think they're difficult. It was a difficult situation, which I hope is solved now.
Amazing, thank you so much. So I can see a couple of people are asking how long it takes to receive your certificate. So if you enter your email address on the link, I'll just post it again for you in case you missed it before. Your certificates will be emailed to you tomorrow. So you'll expect to receive those then. But yeah, I think that's everything. So thank you very much, Sam. That concludes our open session on the feline endocrine disease. Thank you everyone for attending. I hope everyone enjoys the rest of their evening, and we look forward to hearing from you. Thank you.